I'm Shannon Murphy. First thing people need to know is you need to make an appointment with one of the nurse practitioners here. Today I'm going to talk about the usual process for getting STI 15-minute appointment. Student Health Center. When people come in to get screened, we first determine if there's any symptoms of an STI, or if someone has possibly been exposed to one, or know they were exposed to one, or if there was an assault involved. And then we kind of take it from there. If someone just wants to be screened to make sure they don't have anything, just they're not having any symptoms, but they just want a general screening, the process we usually do is as follows. There's a free HIV test, which is called OraQuick, and this checks the saliva for antibodies to HIV, and it's been found to be just as accurate as the blood test. There is a little paddle in here that you rub along your gums on the top and on the bottom, so you collect saliva, and then we put that paddle in a tube of solution, and it takes 20 minutes for the results, and we give you the results within 20 minutes. And this is a free test through the DC Department of Health. Then the other test that we do is for gonorrhea and chlamydia. Again, this is a free test through the DC Department of Health. There's two ways to do it. The way we prefer to do it is to check the urine of males and females. The most important thing is that the person has not urinated for at least an hour before providing the urine sample for this test. In the instance where the person is unable to provide a urine specimen, or they can't wait an hour to provide the urine specimen, then we would do a swab, which is kind of uncomfortable, but it's a vaginal swab for a female and a swab in the urethra for a male, which is at the tip of the penis. But preferably we do the urine test. The most important thing is that the person doesn't urinate for an hour prior to coming to their appointment. Again, the DC Department of Health provides the test for us for free. It takes at least 2 weeks to get the results back. If we're really concerned that someone may have gonorrhea or chlamydia, or they seem to have symptoms of it, we would send this test to our regular lab, which is Quest Lab, and we get the results within 2 days, and that would be billed to insurance. The other STI testing we do is blood testing, and we kind of put together a package to make it more affordable for students, because first, the AU student health insurance, the Chickering insurance, does not cover STI screening if someone's not having symptoms. So people would be getting a bill of a couple $100s if we did it that way, bill it to insurance. And there may be private insurances that, people who are under their parents' insurance, that may not cover regular STI screening if they're not having symptoms. So what we did was we put together a package of the common STIs that can be tested through the blood that cost $75 that you'd pay up at the front desk when you were done. And those would check for hepatitis C, syphilis, and herpes exposure. And we usually get those results within about 2 weeks. Within about 2 days. And we call people, whether they're positive or negative, either way, you'll get a call. Same with the gonorrhea and chlamydia test, you'll get a call either way. And that's it.